another media announcement that certainly there's been lots of discussion about and we've had some questions about is unrelated to vaccination, but related to rapid antigen screening at schools and in childcare centres. So the Chief Medical Officer of Health for Ontario had announced the rollout or the support of the use of rapid antigen screening in certain settings for schools and the childcare sector. So a couple of things about what this means for our region. I wanted to emphasize that in the memo that was circulated and in the announcement, the goal is for use of this testing to be risk-based and to be targeted. So it is not intended to be rolled out in every school and childcare centre across Ontario, because it's the benefits of that approach outweigh the potential harms of children missing school or of what we consider to be false positives. So this test is not a perfect test. Sometimes people might test positive and they don't actually have COVID-19. Any rapid antigen test needs to be confirmed with a PCR test or another lab-based test. And the other important thing about this test is it's only for use among if people don't have symptoms, so asymptomatic, and as a screening test. So we've been reviewing what situations we might end up seeing a test like this in use across our region. There's currently no schools or childcare centres that we would consider to be high risk or have any indication or evidence of high COVID activity. In fact, we're seeing quite low COVID activity amongst most of the community, which is helping to keep COVID activity also low in our schools. So at this point in time, there's not an indication or a need for these tests to be rolled out, but we are reviewing in which situations we might see its benefits and we can use it as a tool to help prevent further spread of COVID-19. With the rapid antigen screening tests, and it doesn't matter if it's being done at a school setting or a workplace setting or a different setting, if somebody tests positive for it, then they would have to go for a test at an assessment center or a PCR test. If this was a school individual, they would have to stay home until they had their test results back. And this is where it comes down to weighing the risks and benefits of widespread kind of rapid antigen screening testing in schools. So it has not been recommended provincially to be done, every student, every grade, because the number of individuals that would likely have false positives and then the consequential kind of having to go for confirmatory tests, lost school time related to false positives, those harms outweigh the potential benefit for mass screening using the test. Only in certain settings where there's a higher risk of actually finding COVID does it seem that benefit outweighs some of the potential harms of it.